Hi, good evening. This is Dr. Chetna Jain once again, and we are together today to discuss how weight increases for fertility issues. So, I'm director at Cloud9 Hospital and director at Dr. Chetna's clinic in Palam, Vihar. So, today we are going to discuss how weight will cause fertility issues. Now, typically for Asians, the BMI should be below between 19 and 23. Weight, a lot of fat gets deposited into the peripheral tissue. या तुम यहीं रखो उसको ऐसे कोई बात नहीं तुम साइलेंट कर रखो hello sorry so there was a loss of contact so so we were talking talking about weight gain and fertility. So as women tend to gain weight, a lot of fat deposits under the skin, and this fat can lead to different problems. So BMI for Indian women needs to be between 19 and 23. As women gain weight, the body proportion hormonal disturbances with increased testosterone and with increasing body weight, especially people with PCO, they tend to gain weight faster. And what happens is they have significant deposits of fat under the skin, and that leads to facial hair growth. So you see, initially the hair growth is on the chin, later on light beard kind of hair growth comes, and finally the frontal hair, the hair on the head, they start dropping. Then these women can also notice black discoloration of skin in the neck and in the underarms and also in the bikini area. So all this is suggestive of increasing weight, causing problems related to PCO. And once you have PCO, your cycles become anovulatory. Now, what is anovulation? Anovulation means no ovulation. That means the egg is not released by the ovaries every month. So typically, all young fertile women between the age of 18 to 40 or maybe 35, they tend to release one egg from either of the ovaries, either right or left, every month, and that leads to fertilization of the egg. Now, if your cycles are very regular, that means if you have a 28-day cycle, your egg typically releases on day 14, and this is a good time to conceive. Now, problem with the women who gain weight, what happens is their cycles, they get longer. And once they have longer cycles, it is totally confusing. Sometimes the menstruation will come in 32 days, sometimes 45 days, and sometimes 60 days. And then it becomes extremely difficult to identify what are the fertile periods. Since because of the modern lifestyle, the frequency of intercourse has gone down, and that makes it extremely difficult to identify what are the fertile periods. Since because of the modern lifestyle, the frequency of intercourse has gone down, and that makes a couple who tend to have regular cycles, if they have regular relationship between day 10 and day 14, they have good 7% chance of conceiving in the same cycle. Whereas between 32, 35, 40, 45, 60, 65, or it may be extremely rare to identify for these their hormones to normalcy. But this is an artificial method to bring your hormones back to. So what is recommended is weight loss. So if you exercise, a low carbohydrate diet, weight, and you will realize that your fertility goes up remarkably. So a lot of you will conceive very fast once you lose. Now, this is again important for women who X amount of weight in the body to conceive. So if your weight is less than 19 BMI, then that is also a challenge. So it is important to keep your weight optimal between 19 and 23, and that is that with that range, most of the women will remain fertile and will conceive. Now, another problem which comes is delay in conception with age. So a lot of women will defer their pregnancy because of the for their careers, or they would want to spend some good time before they have the responsibility. And after marriage, they probably fail to pay attention to what they eat and how they behave. And most of the women, they tend to gain about 5 to 10 kgs in the first month after marriage. I would see very few, about say 10-15%, who are able to maintain their weight, and the rest all gain a lot of weight. And this leads to a lot of challenge, because once you start piling 5, 10, 15, or 20 kilos after marriage in 1 or 2 years, your hormones totally go in for a toss. And once you have significant hormonal disturbance, it becomes very difficult for you to conceive. Some women who are when we do ovulation studies, so thinner women, and when we compare thinner women with fatter women, even if they are ovulating well with the medicine, the thinner women have much higher chances of conceiving, or the women who have optimal obese, and they have lost weight. Certainly losing weight helps, but the most ideal situation is to bring back the body weight in proportion of the fat. If you lost much, then it is not of much benefit. So you should lose muscle mass and you have inch loss. So we are not too bothered about weight loss. What we are talking about, fatty women or obese women, they should have inch loss. Once they have inch loss, their fertility goes up. So please pay attention. Try not to gain weight. And once you gain about half a kg or 1 kg, it becomes a very unhealthy situation. So what is recommended for 10 kgs? It becomes a very unhealthy. So what is recommended for your pregnancy? You try to maintain your weight, you eat healthy, do everything. And also you should meet up your gynecologist to know your current fertility status. What we see currently is many young women also have very low number of eggs, and their quality of egg is very poor. And sometimes even older women like 40, 45, they have good quality of eggs and good number of eggs. So this is a genetic thing which you can't do much about. So whatever basket of eggs you are given at birth, you deplete them gradually, and the depletion becomes faster as you age. That is why it is always right lifestyle. I cannot expect all of you to complete your family by 30. And in this scenario, because most of the marriages are now deferred till 30s, or most important is to identify your fertility. And in case you married and you are in a stable relations and you are still not ready to conceive, what you can do is you can freeze your embryos so that you can use them and you can use them at a later time. This is the same way when you see all these celebrities conceiving at 40, 45. Then that's the way. They have frozen their embryos at a very young age and now they are using it. If your partner is not fixed and you're not very sure you can freeze your eggs, now freezing eggs is also possible. So freezing embryos give much better results than freezing eggs. So freezing embryos give much better results than freezing eggs. But still, if you have no option, please try to freeze your eggs before conceive. So please pay attention to your physical health, eat healthy. At the same time, meditate regularly, try and avoid junk food, do not consume a lot of bottled or packed food, bottled or packed food, because they have all kinds of stabilizers, flavors, and colors, and we do not know what kind of impact they have on their fertility. Certainly, they have impact on aging. As you see these days, women even at a younger age, they look much older compared to their previous generations who used to look much younger, even at an older age. So all this is thanks to modern lifestyle. So we can't change much about it, but if we try to eat healthy, so the advantage would be the more you eat local produce, the less you have carbon footprints, and the better is your body. So we have to do not pile up weight, ensure that your tummy is not coming out. You look at your facial hair on the chin, on the face, on the chin, on all over the body. You look at black pigmentation in your neck, in the underarms, in the bikini area, and you will soon realize if you are having polycystic ovaries. Kidney disease, ovarian disease like a polycystic kidney ovarian appropriately, so that you don't gain much weight and you remain healthy till the time you're willing to expand your baby and have your baby. So thank you very much for listening to today's webinar. And it's the end of the day. I'm a little tired, but I'm still willing to take up any questions. I guess the situation was clear and we do not have any questions. So thank you very much. Oh, I can see one question. Sorry. So does losing weight help at 5 to 10? So if you've gained weight and you understand that you cannot bring it to the BMI, still losing some kind of weight, some kind of physical activity will certainly improve your conception. So please do whatever you can and do not get disheartened if you don't lose weight. Even if you're losing the right way, that means to appropriate diet and adequate exercise. Does weight loss affect egg quality? If you have optimal body weight, your weight, your blood pressure, your sugars, everything will be normal. And certainly, if your physical parameters are normal, your egg quality is going to get better. But if your physical parameters are normal, your egg quality is going to get better. But we can't say that egg quality improves with age because it goes down with age. So it's not aging doesn't happen that fast. For other women, we see that they remain stable for long time. So in this scenario, we need to pay attention to fast. But losing weight will not affect the quality of egg in a major way. But certainly the conception rates, they go down. The other question is, what are the diet I need to take to balance the correct weight? So if you go into that should be coming from proteins. So suppose if your body weight is 80, you should consume at least 40 to 50 grams of protein, and the rest of the food will be coming from carbohydrates and fats. So even when you're eating carbohydrates, you avoid eating simple carbohydrates. Now, biggest culprit is rice and wheat. So if you can, maize obviously. So all these three grains are very fattening. So if you tend to lose weight, you can shift to jowar, bajra, quinoa, and suji and other low-calorie grains. But a better idea would be to consume a lot of lentils and pulses, I mean, and you can have some dairies. And if you're a non-vegetarian, you can have some egg whites. So all this will lead to a healthy weight loss. So thank you very much. We'll see you next week, same time, same day, with another topic. If you have any interest, do let us know and we can cover that. Thank you very much.